Our topic today is on fever. This is an expanded topic on the topic fever, which is entirely different from the fever we discussed earlier. Thank you and welcome to Community Health TV. Kindly subscribe, like, and share. Now, what is fever? A fever is a physiological problem, that is, a problem that arises after the working systems or functionality of the body. When body temperature rises above 37.5 degree centigrade, which is far above the normal body temperatures, then this is considered to be fever. And this is accompanied with high body temperature. When you say an individual or a patient has fever, you take a look at the temperature of the patient, and which is the first thing to do in the clinic when you are to attend to a patient. The first thing to do is to check the temperature of the patient and the blood pressure of the patient. So in the course of examining the temperature of the patient, which is above normal, it is considered to be fever. Having said that, fever is a sign that the body working system is activated to respond to an abnormality in the working systems of the body. And the immune system are being activated in order to fight certain infections in the body. What are the types of fever? There are fever in which it fluctuates between the normal range of the body temperature and to a fever level. That is, it fluctuates between the normal body temperature, which is between 36.5 the normal body be 36.5 to 37.5, and it rises above that, which is above 37 degrees centigrade or likely 38 degrees centigrade. So it fluctuates between the normal body temperature and the fever level. So having said that, we have another type of fever called the remittent fever, which is a fever that comes and goes within a certain course of time. Also, we have the hectic fever, which is a prolonged fever within a certain period of time, which is very high. And we have also prolonged fever or continuous fever. It indicates a very high temperature for a certain period of time, and it is continuous. And also, we also have a relapsing fever. This is a fever that spikes at a certain period of time after experiencing a sustained temperature level, and it suddenly spikes. And now, what are the symptoms of fever? What are the symptoms of fever? We have signs and symptoms of fever. We have headache. Due to the level of temperature, this is then going to affect the temperatures. So we have headache. We have tiredness, in which the patient will be fatigued, and we have pallor, in which there will be less concentration of blood in the system of the patient. And on the pallor issue, you check the eye of the patient in order to see the paleness of the eyes. So on checking that, you discover that there's less concentration of blood in the patient. Now, we have chills. Most fever patients have these symptoms of chills, that is shaking. The body will be shaking. This is an involuntary muscle contraction that occurs as a result or as a response to sudden lowering of body temperature during this period of fever experience. Also, we have night sweating. There are some patients that exhibit symptoms of night sweating. This is as a result of exaggeration or increases in body temperature above normal during a nocturnal period, that is during the night. Also, what are the causes? What are the causes of fever? There are a lot of causes of fever. It might be viral infection, such as COVID-19, can cause fever. We have maybe GIT infection, likely typhoid fever. These are the causes of uh, typhoid fever. These are the causes of uh, fever. Also, we have urinary tract infections. These are infections that affect the urinary system. And even vaccination, having taken one's child to the clinic, the child, due to the injection of vaccine into the body system, the immune system may respond to the vaccine taken in times of fever. This is to indicate the activation of the immune system against a viral infection. And with time, the body system will return to normal. Also, we have certain other things that might cause fever. We have malaria due to the presence of malaria parasites in the blood systems. We have respiratory tract infection, that is influenza. These might cause fever. We have GIT, we've mentioned that earlier, and certain other types of viral infection. And what should we do when patients like this get into the clinic? We or in our community as a community health care attendant, what do we do? What do we encourage them to do? Or what are you supposed to do? We are encouraged to please drink plenty of water, and most likely oral radiation solution, and this should be continued with in the clinic. Now, having said that, we have certain cases in which there will be stiff, the neck of the patient will be stiff, and there will be loss of alertness, and there might be convulsion. And what is convulsion? Convulsion has to do with less functioning, or what we call the epileptic fit, which is called the febrile convulsion, in the period in which the patient experiences this fever. And this epileptic fit is associated with a certain type of malaria infection. Having said that, there are cases of lack of blood, which I have mentioned earlier, which is called anemia. Then there are cases in which there will be infection in the fontanelle, resulting in bulging fontanelle. And there are cases that may be dehydration. And also lethargic, either the patient is unable to walk, and which the patient might be carried to the clinic. So in all these conditions, the antidote, the advice we can be given in the community is to encourage our the patient to drink a lot of water, and the patient to be transport should be organized for the patient to be transported into the clinic for quick action, in which the community health workers, the community health care assistants, we approach the patient and take good care of the patient. Let us take care of ourselves, wash our hands, and in order to prevent the spread of infection, and a lot of it accompany a lot of infection, and accompanies other variants of infections in or viral infection